Thanks for being with us today for our Q2 Healthcare Industry Consortium meeting, second meeting of 2025, and our first meeting in person this year. So we experimented with having the Q1 meeting fully virtual, given the unpredictability of winter travel, and that seemed to work out really well for folks. So would love your feedback on that. We'll start with some introductions. My name is Jennifer Purcell. I'm the Director for Future Ready Oregon at the Higher Education Coordinating Commission. I did just want to start by letting you know that Maggie Forey has moved on from the position of Healthcare Consortium Strategist. So I'll be helping to facilitate today, supporting the leadership team, and we will also be getting some facilitation support from Nick Rectumwald. You can wave at folks. Nick is the HEC's Manufacturing Consortium Strategist and facilitated some of these similar discussions in his Q2 meeting just a couple of weeks ago. So thanks for helping to provide that support. Why don't we start with a quick round of introductions? We do have a number of guests with us today, so it'd be good to know who's around the table, and I'll give them the opportunity to introduce themselves as well. Brian, do you want to just name and...
I'll kick us off. Good morning, I think. Brian Duringer, Oregon Medical.
And I'm Nicolette Rowley with the Oregon Health.
Hi, Neelam Gupta with Oregon Health Authority.
Everyone, Sarah Foster, Governor's Office.
Chris Demars, Oregon Health Authority.
Abbott Curler, Kaiser. Rob Winningham, Western Oregon University.
Melissa Unger, SEAU Local 503.
Good morning, Maria Arvilla with Governor's Racial Justice Council. Can I do a quick commercial? We're having a conference on May 22nd. It's called the Healthcare Workforce Equity Conference, and it's basically to promote workforce within healthcare, but also to increase the bilingual cultural healthcare workforce throughout the region. It's a free conference, and please welcome to attend. Jennifer, can we send this via email to all the... Great.
Absolutely.
And there's a QR code you can register online, and there's no cost at all. It's for the community, free to anybody that wants to attend. Thank you.
Can't top that. Becky Holberg, Hospital Association of Oregon.
Morning, Duncan Weiss, Oregon Business Council.
Hi, I'm Heather Ray with the Oregon Council for Behavioral Health here on behalf of Heather Jeffress.
Hi, I'm Liz Rain. I'm over at Oregon Department of Education.
Shanna Bitten from the Oregon Center for Nursing.
Dave Kohler from Road Community College.
I already got a little introduction. Nick Rectumwald, Manufacturing Consortium Strategist. Doing a little pinch and
Nick, I'm going to go ahead and introduce or let our guests introduce themselves as well.
Good morning. My name is Chad Bash. I'm the HR director for a small healthcare clinic in Wheeler, Oregon on the coast, and we are a grantee. Our grant program is called Pathway to Equity, which is all about creating new healthcare career models.
Hi, Rick Allgaier, I'm the research director at the Oregon Center for Nursing.
Maria Carrillo, also with Chad from Nehalem Bay Health Center.
Dr. Carlos Texero-Amanalo, assistant professor at Western Oregon University and CEO of Richard Community Health.
Sean Roush, I'm the program director for the occupational therapy program at Western Oregon University.
Good morning, everyone. Jose Cole, provost at Western Oregon University.
Good morning, everybody. My name is Denise. I'm the manager of workforce development for Ant Farm Youth Services.
Hi, Molly Hendrickson with the Oregon Employment Department.
Shauna Tice, Technology Industry Consortium Strategist.
Hi, I'm Alex Bruno. I'm a research analyst at NEC.
And Carrie Thomas, Program Manager with Future Ready Oregon at HEC.
All right. Thank you, everybody. I think unless there are other announcements from the leadership team, we can go ahead and hop into our consent agenda. Rona, do we have a quorum quite yet?
We do not.
Are we still short one person? All right, so we will keep an eye out for folks. If you want to take a look at your January 28th minutes, I actually think, Nick, you were gonna remind us of a little activity using the minutes. We can probably go ahead and do that while we're hoping for one more person to join.
Yeah, for now, this will be a test run, pre-quorum. So in front of you, you should have 3 cards, green, yellow, red. And I'm hoping that these are somewhat familiar to you all. I believe you were introduced to the consensus-based decision-making approach at your Q3 meeting last year. Maybe it was Q2. But we have an action item on the agenda later with some occupation and wage data profiles that we'll be sharing with you. And we're going to use the consensus-based approach to hopefully approve that action item, if we reach a quorum. However, I thought it would be, I think talking with Jennifer, we thought it would be a good idea to just practice with this, brush off the dust and let's do it with something easy like the minutes. So will you advance the slide? The idea here is that we are trying to reach consensus, not just doing an up or down vote. So per the charter, if you cannot reach consensus as a consortium, then the ELT can make a motion to ask for an up or down yay, nay vote, and then we would go with what the majority. But the idea is to try to reach consensus. And if you'll advance the slide one more, really, this allows us quickly to see where folks are at with the action item. So green, when we ask you to kind of hold up your card where you're at with something, green just means, yep, I'm good with this. I support the proposal as written. I don't need to see any amendments to the proposal. I have no significant questions. Yellow, though, is, I'm leaning towards supporting it, but I have some questions. Maybe I have some concerns. Maybe I'd like to see a tweak here or there. So, you put that out in front of you, and we know that you have something you have to share, and we can discuss what that is. And then red is, I really have a concern with advancing this action item per the language. Doesn't mean that I couldn't be convinced, but it does mean that we need to stop and find out what the concerns are, have that conversation, and see if, we could get you to a yellow or a green, ideally. Usually, if we get to that final, all right, do we have consensus? If almost everybody is green and we have a few yellows there, then we feel like that's consensus and we're going to move that forward as approved. But a red for the agenda item would mean that it's not going to go forward through the consensus-based agenda, and we would then likely ask the ELT to call for a vote on the issue. Any questions? It's relatively simple, but any questions about this approach to decision making? It's a little bit different than Robert's rules, which I'm sure most of us are used to. Great. I saw one person walk in. Does that mean we have a quorum? Wow. So we get to do this live. Yeah. Hey, you're the hero, Gail. You gave it the quorum. So yes, if you would take a few minutes and look at the minutes from the January meeting, and then if you are good to approve these minutes, if you would put your card, whichever one you choose, in front of your name tag, that tends to be the easiest way for us to see where you're at. Yeah, we were gonna practice with a red card to see if we could navigate this, but. Chris, can we talk about your question?
I'm just not noted as having been there, but I was, and the reason I know I was is because when I looked down, like, oh yeah, I asked that question about future reports. I remember asking it. So, and I'm not on the left-hand side either. I mentioned that before, I think.
We can amend. Any other questions? So then the action item here is to approve the consent or approve the minutes from last time as amended, adding Chris to the role. And does that change anybody's? Yeah, go ahead and hold up your cards, I think, if we're ready. The other thing, that looks like 100% green, we've reached consensus. The other thing I forgot there is essentially an abstain option too. So you can stand aside if you so choose. But great, that seems like consensus on the minutes, and we'll make that change, and those will be posted with the rest of the meeting materials per usual. Thank you.
Thanks, Nick. And Nick will be back with us shortly. Ronan, just want to check in with you. I know we have reached quorum, but do we have anyone registered for public comment?
Not at this time.
Okay. All right. Well, with no public comment at this time, we will keep moving through the agenda. The balance of our agenda today, hopefully you all saw the packet of information about occupational and wage data profile. And we introduced this work in Q4, I believe, of last year. And some work has been happening in the interim. Ronan's going to walk us through a bit of a refresher about this body of work. And today we're going to move through discussion, reorienting ourselves to these, and then considering the six or seven initial occupational profiles that are in your packets today. So in support, I'll turn it over to Ronan, and in support of this agenda item, you will want to reference, there's a copy of the slides in your packet. There is a copy of the occupational profiles you'll be considering today, and then a full data set of the healthcare occupations to be considered over time. We will have some time for breakout discussions to reflect on the occupational profiles a little bit more. And HEC staff is here to help facilitate those. We'll come back together, report out, have any further discussion on the occupational profiles, and then move into consensus-based action item to approve that initial set. We will have a legislative update from HEC's Director of Legislative and Policy Affairs, Kyle Thomas, a little bit later. We'll break to grab lunches, and then thrilled to have a panel with us today to speak about Western Oregon University's bilingual mental health professionals program. And then we will wrap up by 1 o'clock today. So thank you all. I'm going to go ahead and turn it over to Ronan and Nick to kick off the next agenda.
All right.
The first slide is me.
Yeah.
So we have a couple of objectives for you today. Ronan is going to run you through, as Jennifer said, the legislative mandate that this action item is connected to. And that's one of our priorities for today's meeting, is to move forward with what the legislature has asked each of the consortia to do in terms of publishing some occupation and wage data. So we're going to look at these packets. We're going to have a discussion about them, and then at the end of that discussion, hopefully we're going to feel like we're ready to move toward, again, consensus. And so the action will be to approve this initial set of occupation and wage profiles for this sector. And those profiles will set wage rate standards by locality. We'll talk about what each of these look like in there for the skilled occupations. And, you know, I think the legislature's intent with this bill was to improve transparency for training participants. So that's the goal today. And I'll kind of let Ronan review some of the background to this, and then we'll get into the profiles themselves.
Yeah, sounds good. So we thought it might be helpful to just
provide a refresher of what the actual legislative mandate of this bill is. This was passed in 2023, and it included, in addition to this mandate for the consortia, a number of other technical amendments to existing workforce statutes. For our purposes today, we're going to be concentrating on this though. So Section 5 of House Bill 3306 directed each industry consortia to establish wage rate standards varied by locality for each skilled occupation within each of the respective industry sectors. Each consortium under this section shall recalculate the wage rate standards described using relevant economic and employment data made available by the Employment Department, and then recalculate those wage rates every 2 years with some sort of summary methodological document. As Nick was saying, the intent behind this bill is really about sort of wage transparency for participants in programs. Pretty early on, we had some discussions with our legislative and legal teams at the HEC to determine that the HEC does not actually have the statutory authority to set or enforce strict wage standards. So really, this is an exercise in publishing data transparency for our participants in training programs. We thought it also might be helpful, since you haven't seen this since Q4 of last year, to really provide a timeline of sort of where we've started with this project, where we're going, where we're at right now, and where we hope to go. So to that end, we've sort of broken it out into, I guess, 3 phases. The first, which really we've sort of spent the majority of our time in up to this point, was essentially just determining what establishing wage rates varied by locality for each skilled occupation actually means. If you recall from Q4, we previewed some of those definitional choices we made around skilled occupation and locality. Again, just as a reminder, when we say locality, in this instance, we're going to be using local workforce development board regions. When we say skilled occupation, we're going to be using the Oregon Employment Department's definition of a high skilled occupation, again, to align the data that we're going to be publishing with what the Employment Department is doing. Where we're just getting to right now is sort of phase 2, which is actually meeting the minimum statutory requirements. So publishing Oregon Employment Department data for high skilled occupations in each sector, which we really have just started to do with each of the consortia. And then based on some feedback that we received from Q4 from this consortia and then Q1 meetings in technology and manufacturing, there's been a lot of conversation across all 3 consortia about using this data to sort of this body of work to advance consortium objectives. We were building out career pathway maps, credentialing and opportunity mapping, identifying training providers, graduation rates, and then identifying further opportunities to utilize this body of work, this project, through working groups. Okay, again, a little more context from some of the stuff. So to really just give you an idea of what it is you are looking at and what it is you aren't looking at, we thought it might be helpful to briefly summarize the Oregon Employment Department's wage data sources and their methodology when you're looking at this. Again, I'm not going to claim to be an expert in wage data analysis, but a lot of this we've just taken straight from the guidance we've received from our partners at the Employment Department, like Gail and Jason Payton as well, who will be joining us later. So the wage estimates you see in those profiles are all coming from the same federal program. It's the Occupational Employment and Wage Statistics Program. This is a survey that is administered in Oregon by the Oregon Employment Department. I think it samples around 18,000 businesses over a course of 3 years. And so the wage estimates for each of the occupations in those profile packets that you're seeing are based off of this survey over the past 3 years. They do not necessarily reflect specific experience or educational levels. I think it's also important to note that an occupation in this, like when we're talking about a single occupation in that profile packet, is not the same thing as a job title. So a good example of this is registered nurses. This is a classification of occupations of similar kinds of jobs. So under registered nurse, for example, is included psychiatric nurses, hospice care nurses, that kind of thing. So there's 850 detailed occupations. So if you think about the vast number of job titles and the relatively few number of occupational classifications, there's a lot of sort of narrowing in that has to be done. So just keeping that in mind. And then one last definitional reminder, again, we say high skill, we're referring to, or we say skill, we're referring to high skill occupations. This was a definition developed by the HEC, ODE, the Oregon Employment Department, and the local workforce development boards, I believe. And this, an occupation is considered high skill if it has a typical education level needed for entry of post-secondary training higher, or occupations with an apprenticeship as a typical on-the-job training level, or occupations typically needing related work experience or long-term on-the-job training for entry and post-secondary training or above as competitive. So essentially, anything that requires some level of post-secondary training or education is considered high skill under this definition. And with that, I'm going to hand it back to Nick.
So I think one of the key things to take away from all of that background is we do have a legislative minimum requirement to meet. And what we're doing is repackaging already publicly available data. What you're seeing in front of you is not data that's been generated by the HEC, but we have packaged it together in this way in consultation with the consortia, all three. In the case of the healthcare consortia, the nursing demand planning work group was pretty instrumental in the selection of this initial packet of 6 occupations. However, and just so you know, I'm sure you've seen this, there are essentially a couple documents in your folder if you haven't looked at. There are the slides, so you can review the definitions if those are helpful. There's also this printout of a pretty lengthy spreadsheet. These are all the occupations that fall in the healthcare sector. However, I mean, if you look through some of these, there are things like carpenters and electricians. It's not necessarily that we think that every one of these will get one of these data and occupation profiles, but that's something that we need to engage you as a consortia in, is what on this list fits into the healthcare sector such that we can meet the legislative requirement. And then the last thing is the actual packet of profiles with the 6 high skill occupations that were identified by the nursing demand planning group. So that's where we started with these 6. The goal is to create versions of these profiles for all the healthcare priority occupations on this larger collection of data, and we'll work through that at Q3 and Q4 likely. But we're hoping today to get you to approve this initial set for publication. So we can say to the legislature, hey, we're moving things along at a pace that's appropriate and that the consortium feels comfortable with as well. So with that in mind, why don't we move to the next slide, Ronan? The fun thing about this particular project is that not only do you individually as a consortium need to approve these profiles, all 3 consortia have to agree on the format of the templates. There can't be a healthcare template that's different than the manufacturing. So we're going to be doing some interesting synthesizing of feedback from the 3 consortia over the next couple of quarterly meetings so that we can arrive at a consistent format for this genre of publication. And so just so you know where you're kind of at in that larger consortia process, the manufacturing technology consortia spent some time with these profiles at their Q1 meetings. Y'all were really focused on that excellent behavioral health talent assessment. You had, some other things to focus on. So we knew that we would bring this back to you in Q2. However, the nursing demand planning group has looked at these occupational profiles. I believe the ELT has looked at these. So it's not that the the healthcare consortium hasn't engaged with these on some level, but today we really want to spend some time with you all familiarizing yourself with these templates, addressing questions. Ronan mentioned that Jason Payton from the OED will be here around 11 o'clock today. So if you have specific data related questions that we can't answer at the HEC, Jason will be an excellent resource for those questions. And when you're in the small breakout discussion groups here in a little bit, make sure you mark those questions so that needed. Yeah. Oh, and yeah, I will say in the manufacturing consortium meeting a couple weeks ago, we relied quite heavily on Gail from OED as well.
I'll happily refer anything.
Okay, yeah, we do have Gail from OED in the room too. Thank you, Gail. Didn't want to put you on the spot if you were trying to keep a low profile today. But so what you're seeing in front of you has gone through some feedback already, a couple of feedback loops. And what we hear across all three consortia, we're still trying to, I think, calibrate, what feels accessible. And that's kind of what we're going to be asking you to focus in on, what feels accessible to the target audiences for this work. We heard that there needs to be more focus on regional differences in both wages and job openings. That is reflected, I think, in the version of the profiles in front of you. And then we also heard that because this is repackaged data, there were a lot of requests for things that would be great to have in these data profiles, but are not part of the publicly available data set. So when Ronan was showing you that timeline, and we've kind of moved through phase 1 of this work, this is phase 2 of the work, meeting the legislative requirement. Phase 3 of the work is thinking about, well, what else could we do with this information, or what would supplement it, what would support it, what would help the consortia meet its workforce planning and planning goals, really. So that's where we're at with the other two consortia, as well as how we've discussed it so far in the healthcare consortia. Any questions so far? Lots thrown at you. Yes.
So I was noticing in the timeline you were talking about how the third point is going to be advancing the consortium objective, and part of that is going to be identifying opportunities to continue utilization. I'm part of the nursing demand planning group, and I asked this question there, and I don't remember that I got a very satisfactory answer. So I want to ask Kira, maybe you can give us the perspective of the other groups. How are these profiles intended to be used? Are they only intended to be used to meet the requirements of the legislation, or was there some other discussion about how this is going to be used in the general?
Yeah, absolutely. Great, very good question. So the way we talked about this, for example, in the manufacturing consortium, is that this provides sort of foundational work to what we hope to do in terms of some opportunity mapping in the consortium, so that we can use these. I think one of the discussion questions today for you all is, who do you think the target audience for these profiles is, right? So we're hoping the consortia can give us some indication there. I think there's a bit of an assumption that the target audience for this is actually students, families, people considering career changes, and what information do they need to make those decisions, so that a guidance counselor, folks in career readiness services at universities and community colleges could point to these data profiles and say, you're interested in these pathways. They can print one of these off as one. We really actually tried hard to keep this to one page that can literally just be handed to someone as needed. And then to build out what we're calling opportunity maps, where there can be more information embedded online about where you can receive training for these, the credentials that are necessary, or the licenses that are necessary as well. Thinking about using these to prioritize some supply and demand planning, so using these occupations, and especially the ones that the consortia identify as high priority, to start with supply and demand. So I do think we're thinking about them for a couple of different audiences, but generally we're thinking about a very general audience. Does that help to answer that?
Yeah, it does. Right now, it kind of looks like it's designed to meet the needs of the legislation. And this would be very, very great for like a legislative audience.
Yeah.
I'm not certain that I would agree at this point that it would meet that audience you just described. However,
we're gonna be discussing it.
That's right.
And I'll just add, Jana, it's a great question that we've been wrestling with in all three of the consortium. You'll be talking a little bit more about that in your small groups today. But I think the initial objective is how do we meet the legislative requirement to get occupation profiles and wage data published for the healthcare, manufacturing, and technology sectors, given that there's, I don't know, the better part of 450 occupations, and we really do want them to be useful. We don't want it to be a check the box exercise. So what are those minimum requirements to do that? And I think what you'll see in the profiles is content that reflects the feedback we've received so far. And then some of the things that Nick was referring to that are a bit more aspirational about who is this designed for, how could it be used, and what additional information would be useful becomes sort of that next step once we get these initial sets published.
Yeah, I think this is as much about dipping our toe in the water of this work as it is anything else today. So why don't we take a look at one of these? I'll walk you through the general format of these profiles, and then we're going to break into small groups to have more of a discussion. We'll come back. I think, Janet's question is a good one that I imagine we'll be having some more conversation about. But each of these profiles has an occupation description, and Ronan, can you remind me where the occupation description comes from again?
That comes from the Bureau of Labor and Statistics standard classification system for the occupation.
So Bureau of Labor and Statistics generates this occupation description. I think this is, I'll just name this as one of the areas where, I think there was a little hesitancy about who is this, does this occupation description actually meet the need of a generalized audience? At the same time, we do need to find an objective description, right? So it may not be perfect, but trying to find something that we can point to as a relatively standard objective description of the occupation is what we're going for there. We also have education requirements that are typical entry level, but also what is considered competitive. And then we point to qualityinfo.org, which is OED's website. If you're not familiar with this, much of this is taken right from qualityinfo.org. In fact, if you look on the, if you're looking at the actual paper profile, where the title of the top is there, that number would hyperlink to the quality info profile, which is a little bit more in depth than what we have here. Again, trying to focus on condensing information for legibility issues. We indicate where the industry of employment is. We also give projected employment change by workforce board region. And we're doing annual openings and growth openings. So really what you're seeing there is there are 74 growth openings, and then the replacement openings are sort of less than 74. But altogether, with replacement openings and total growth openings, the green bar is telling you how many openings are projected for that occupation in that workforce board region. If a workforce board region is not represented on the graph, and if you look at a couple of these, there are a few that only have like 1.2, it just means that there's no openings for that occupation, or we don't have data for that local workforce board region for that occupation. You can advance the slide.
Sure.
Thank you. And then on the back, we have a couple of things that, again, were the result of feedback, trying to break out total employment as of May 2023, and then what the median hourly range is and the average annual wage, so that folks can see, both at the annual and the hourly. I think those two data points communicate differently to different audiences, and it's easy enough to provide both. So that's why we have those there. The other thing we have at the bottom of this are the knowledge and skills that this occupation, generally needs to have to succeed, and some detailed work activities. Again, thinking about handing this to a student or somebody that's interested in this career field. Maybe they want to think about what classes they need to take or where they should focus their efforts. The idea here at the bottom is to give them some sense of where to focus their own efforts in a very general sort of way. That's what each of these profiles, the format that each of these profiles takes. Yes.
Can somebody explain why the wage in Rogue Valley is so high? $16,000 compared to most of the parts of the state.
Yeah, I'll do any questions.
Hold on, nursing assistant.
Yeah, nursing assistant in Rogue Valley.
Rogue Valley, about 70,000.
Honestly, I don't know this particular industry in this area more in any more depth than anything else. So two things that I would mention just off the top of my head, this is like a rotating sample, so we're not getting every business every time, right? So it could be who's in this set. Because one of the things that we know about nursing assistants and about nurses in general is that depending upon which type of healthcare setting that you're in, those wages can differ a bit, right? And it looks like the median doesn't look ridiculously different in Rogue Valley than it does in the hourly. So it could be something else that's pulling that up on the annual average, depending upon like maybe what setting it's in, or if there's a bunch of jobs that happen to be in the more experienced upper range of that, then that's going to pull that average up, even though the median looks about the same for everybody. So I'm not sure exactly what's going on, but that's my first suspicion, is that it's a combination of who got surveyed and which type of settings maybe got captured in that panel.
Any other initial questions?
Questions about methodology they go. Well, that's so, with regard to the surveying, like what's the response rate generally? Like, do you do a sample and then in some cases you don't get much of a response and then you try again? I mean, or is it just who responds? I assume it's the lab.
So over the course of, like I said, it's a rotating panel. So over the course of time, everybody, all private businesses, are surveyed. Oregon is one of just a handful of states where response to this survey is mandatory. By mandatory, we get above 70% response rate, which is very good, actually, if you think about it. So in terms of are people responding, generally, yes, quite well. So we don't seem to have huge gaps. That one of the things that you will find, and that I did notice, and that also came up in the manufacturing consortium, is that you'll look at some of these profiles, like nurse anesthetists, for example, and you're going to see that there's an NA for some stuff. And even though people are generally responding, not everybody's responding. And also, Oregon's one of the only states that actually breaks this down below if we were some other state, you would get this for the state, you would get it for Portland, you would maybe get it for Salem, and that would be pretty much it. So that we break it down more, we're taking that sample and whether or not we get a response in some of these areas where those jobs are less concentrated and there's just not enough there to publish anything. So NA doesn't mean they don't exist. It means we didn't get enough responses to be able to publish something that meets our publication standards. And or if you look over on this lovely, very long thing, there are, it says relative standard errors. If those are above, I think it's plus or minus 30% for employment, and plus or minus 50% for wages. So also, to the question earlier about wages, there's a margin of error in some of these responses as well. If it's beyond those error ranges, then it also doesn't meet the Bureau of Labor Statistics publication standards of self-published.
Thank you. In the interest of time, because we have, if you have more questions, we have time for discussion budgeted. What we want to do is break into small groups and spend some time with these profiles. We have some specific questions that we want to ask you. Can you advance that for me? I think it's very much related to Jana's question about who you envision as the target audience for these profiles. Again, we have a legislative requirement to meet, but we want to meet it in a way that feels like it's tied as closely as possible to who you all as the consortium feel is the appropriate audience for this work. And so what sorts of questions would these audiences have about these occupations? And do the profiles answer those questions, right? So what's being answered there? What's not being answered there? Doesn't mean we're going to be able to answer every question that's there, but it's good to know where the consortium is thinking about this. And then are there ways of presenting or formatting the data that you feel like would be more legible or accessible to the audiences that you identify in that first question? What we'll do is we'll break into 4 small groups. I'm just gonna have you all count off 1, 2, 3, 4. Yes.
Quick question before we do that, can you just remind us who's on the nursing demand planning work group?
I can't off the top of my head, but I will.
I am.
So there's Jana, Dave, Neelam, Nicolette, and Becky.
And I think there are others, but I don't love them.
I think Rachel Kruzak also, right, on it, and then, SEIU,
That's
So it sounds like 7 or so folks on the. Yep.
Helps to know which experts.
Absolutely.
already looked at the-
Yeah,
Yeah, absolutely. Thank you. That's a great question.
we could make sure that they're dispersed if a group ends up not having someone from that work group. We make sure.
So we will just count off 1, 2, 3, 4. Real easy like that. We're gonna kind of split your ELT up, so they're not gonna count off, they'll go with a group. And then once we count off, we'll go from there. So if I could just get you to give me a 1. You get a 3.
Sorry.
You're good.
Sorry.
4. 1,
2.
3, 4. And then we're gonna go all the way over to. Oh yeah. Okay.
2.
Okay, so let's do this. Carrie and Shauna, will you stand up in the back there? So if you're a 1, why don't you huddle near Jennifer there? If you're a 2, I'm gonna take the 2s and we can huddle somewhere over in this general vicinity. If you're a 3, Carrie, wait, or you're 4, sorry. 3, Shauna, and 4, Carrie, you guys are gonna go into the next room. There's a room right next door, and there's plenty of space to have a nice conversation there. And we'll come back in about 20 minutes. So shoot to come back 11:10. 11:10. Report out what each of the groups discussed, and we can address questions that came up in those discussions. It looks like Jason's online. That's great. So if they're really, data specific questions, we've got Gail and Jason in the room to help us. But what I'd like to do is just perhaps have each group kind of high level summary of what you discussed, and then we can get into questions and larger group discussion. So who was reporting out for group 1? Great, Hannah. Yep, no. I bet you can.
Okay. So our group got through the first question only. You are all welcome. You're all deep thinkers, and we gave it a lot of thought. So the ways of presenting the data or what date or information would complement the wage, forget it. We didn't get there. But I will talk a lot about, the first one is, who do we envision as the target audience? It kind of, our conversation broke down into 2 things, and I think a couple of other groups, because Dave is the first one that tipped me off on this, and then I was lucky enough to have Gail in our group. Some of the data from the spreadsheet that was included in the packet does not match up with what's on the profiles. Now, the profiles all say draft, so I'm not so upset about that. But we did have like a discussion about like, well, what are we drafting here? And it kind of really reminded everybody, me mostly, but it reminded all of us how complex it is to pull all of these numbers together. This is a complex and hard thing to do because you've got different data sources that you're looking at. You've got to make sure that everything is coded a certain way. So that actually led into the discussion about who is the audience for this, because if the audience is a generalized audience and you have all of these complexities, it makes it really, really, really hard. Especially if you're trying to keep something to 2 pages, which is easily digestible. So there were some in the group that were talking about like, well, what do we need to do if we want to make it available to a high school student so that they could be asking it? There were other groups that felt pretty adamant, and that would be me, that this is really kind of more of a policy document that would make a lot of sense. If you're going to be using it within like the health authority might use this as a reference, TEC might use this as a reference, legislative fiscal office might use it as a reference. Use it as a reference document as opposed to something that you're going to try to push down all the way to a high school or a middle school level.
Especially because the RMs went, it took me like a hot second to figure out what was going on. But one of the things that we found is that, and I mentioned before, I'm glad that somebody asked the question earlier, that in this is private sector. there are about 25,000 government healthcare jobs. VA hospitals, local hospitals in rural areas, things like that. So when you get to the profile, you do have information for all of those internships. But this, if you're looking at just the healthcare industry, which it says it is, that's not, there's also RNs in schools and other places too, right? They're not in here. The government ones aren't in here. So just for everybody's general awareness on that.
That makes sense, especially for this, the realities of employment in this sector. That didn't really come up in manufacturing, but it would make sense as something more here.
All right, group two, very similar, but kind of a different slant in terms of wondering who the audience is and thinking like this document might, and with some tweaks, work for the, people like us and maybe legislators if they are interested in reading it, but then also thought about creating a separate one for youth interested in different career paths, and then maybe a slightly more kind of sophisticated one for counselors, giving them more kind of background, detailed information if they're talking to students. And then we identified a number of things that we thought were missing or needed to be changed. Like, for example, there's a need for the supply and demand, kind of annual openings per year, not, and where are people getting employed? The kind of knowledge and skills piece, it felt more like soft skills and maybe could be taken out. Focus on the occupation description more than the kind of knowledge and skills. Growth openings show it as a percentage in post-secondary training is really generic and get more descriptive, because like for nursing assistants versus NPs, I think, or some who are completely different post-secondary, and it uses the same words for this.
And group three, who's reporting out for group three?
Hi, I think everyone mentioned everything on our list except the one thing that came up was maybe employers would be able to use this. And we looked at this as like, what are the possibilities of where it could be used? So we had an employer from Kaiser in our group who mentioned they might use it for like a bargaining point during negotiations with a candidate, to highlight like their benefits versus wages. We also took a minute to focus on the career pathway discussion, that it could be used more robustly in that way. We're just answering one, right?
Or if you have information on question two.
We only got to one.
Oh, okay. Okay, so ways of presenting. We thought career mapping, those pathways again, like an illustrative element to it. A couple of our members mentioned that there are on certain websites like o.net and qualityinfo.org, there are those click-through menus for pathways. So if there was going to be a digital element to that. And then we thought on the map, the illustrative map part, maybe a listing of the largest employers in that area so people can connect it to like where they might actually be working.
Interesting. So OED could not provide that data, you're saying?
I am by law
Okay.
in any industry area, anywhere.
Interesting. Okay.
You're gonna ask what's the logic?
So let's say that so we're required by law to protect any individual company's information that they report to us. So if I'm the head of Dale's Telehealth and I want to go tell the Statesman Journal, I have 2,500 employees and I'm adding 200 more. That's me personally disclosing by my own choice to tell them how many employees I have. Now, if I report it to the employment department, I'm saying like our exchange for getting responses, which can be hard enough, is we're not going to go then say out publicly how much you pay your telehealth consultants, right? And then the other thing in terms of protecting someone's company level information. So first of all, that's the agreement that we make with them when they agree to, that's the part of the law for giving us the data and plus making it mandatory in a lot of these cases. You have to tell us, but that doesn't mean we're going to go turn around and tell the whole public what you pay. The other thing when it comes to these ranking lists is that if I'm the number 2 employer and I just told you I've got 2,700 and I'm paying them, $32 an hour, and now I know that Rick's telehealth is number one. Well, now I know a little something about him and how many things I did. So it's like, it's a way that I'm calling his stuff out and making it to the, and in some really smaller communities, a lot of people know, or anyway, or they'll say, but it's just that when they sign the dotted line with us, that they'll give us their data and we're saying you have to do it. In exchange, we're saying we're not going to turn around and tell everybody the information you give us. We're only going to compile it and make it statistically not in a way that you can figure it out. So we're putting your confidentiality. So that's 3 employers in any industry that we publish, and there has to be no one employer that makes up at least 80% of wages.
Right, so that's the legal landscape, which is interesting to know. But yeah, we were thinking more of like examples of employers in that area where you can work. And so, yeah, if that gets us into trouble, I don't know anything about that. But I forgot to mention, number 3, we got to just busting down those minimum qualifications into simplified language for candidates so that they understand. No, not everyone who's coming out of like with a high school diploma knows what post-secondary means. So maybe busting that down and defining what is entry level, other qualifications that are required, like are there background checks, like those specific things people can know if you're going to use it for a different audience. And then qualify that assertion of competitive, like there's that definition of competitive, we kind of circled there. We're like, what does that mean to a person, to a candidate, to an employer?
That's an OED category, right? What can you define that?
So 2 things, 2 ways that I try to, because like I said in my, I love a good classic, SOC definition, but it's not very, what is this like? What is the day in the life of this job like? So ways that I try to break down, use different terms when I'm, just talking about it, not reading whatever the book tells me, is I'm saying, that requires education beyond high school, or for certifications and credentials, we'll say something beyond high school, but not a bachelor's degree, it's like you're in that middle zone. So instead of saying post-secondary. And then for education requirements, typical education requirement is, this is the very minimum I have to do to even be able to apply for this kind of job. I have to get an associate's degree. I have to have a bachelor's degree for this. Competitive is like, let's say, not as it is in this specific moment right now, not saying anything about the past or future, is that if it's not a really tight labor market where it's hard for employers to find enough, when there's more job openings than there are available workers for something, like employers are competing, like they're more willing to go for that, to go, like they need somebody. If you're not in a situation like that, if unemployment is higher or if hiring is slower, if there are, a lot more folks that are looking for a specific type of job, then employers can take competitive. And that's like, if I'm applying against, someone else for a job, what's going to give me that leg up? It's not just the minimum to work. It's like, and I've got 5 years of experience and I already went and got this other special certification. So there's some more competitive level that makes you kind of have a leg up on your peers if you're competing for a job. And in different economic conditions, one tends to be, kind of the going requirement versus the other.
Yeah, we talked ourselves through that, but maybe like if you're going to package this up for a different audience, it would be like explained.
Great, thank you. And then who is group 4?
So on the first question, there were 2 big groups of audiences. One is people who would be using the information for policy making or planning, and that can be public or private sector, but policy making and planning. And the second audience would be students or workers. And I think we differentiated students and workers who may be looking to come into Oregon from outside the state, or people who are second career. So kind of two different audiences within that subgroup. On the second question, I'm going to kind of combine it with the third. They kind of went together. Some suggestions. It'd be helpful to see the overall state average in some of these numbers. They're all broken down, which is helpful, but also some, especially like universities, plan at a statewide planning level. So the statewide information is important. Growth projections. There's a simpler way of identifying growth in occupations or a longer time horizon for growth projections might be helpful. retention data, if there is retention data available, that would be useful. And then the knowledge and skills and examples of detailed work activities were confusing and perhaps very confusing, I would say, for some of these occupations. And so either take it out or find a way to get more specific, or sit down with someone who does that job recruitment and say, what are the top 5 things? Because the ones that are here were confusing for some of the occupations. And an example just of that is like having psychology as knowledge under the RN, which, you know, an RN may take one psychology class, but they may look at that and say, oh, I don't have that knowledge, so I can't apply. And then the last, I think, bit of feedback before I'll see if anyone else in the group, if I missed anything, is that it may be useful in wherever these land to have links to other information that adult workers, or especially out-of-state workers, because specifically with RNs, we tend to recruit from out of state quite a bit. So links to things like, where do I find out about schools and housing costs and cost of living and all of the things that someone who might be coming from out of state would want to know. So we don't necessarily want to be hiring like a lot of people from out of state, but that's kind of the reality right now.
Clarification, when she says school, she means schools for the children.
Thank you.
Not
Yes,
schools.
education system.
Yeah. That makes sense. We are at 11:30, Kyle.
No.
I was gonna say we could do a straw poll where we're at with these, and then hear, if he's here, his legislative update, and then come back to the discussion.
What's the straw poll on what? What are we voting on? Yeah.
Can you go back to the ask, or whichever side has these?
Yeah, sure.
Yeah, so approving these 6 occupation profiles as presented today in front of you, with the noted, there wouldn't be any changes to these if we approve these today. That doesn't mean that there wouldn't be changes between now and Q3 or now and Q4, but approving this would allow us to publish these data profiles on the HEC website and, again, meet the minimum legislative requirement. For the record, manufacturing had a number of concerns with these profiles, but they did end up approving these as an initial set to publish on the site.
I'm just gonna jump in. Kyle Thomas is unable to join us today, so we have time to wrap up the discussion and action items, and I would suggest if we take an initial straw poll to see where folks are at. I think I also just want to affirm for you all that the feedback that we get from you here and across the consortium are things that we will continue to iterate. We'll be bringing additional profiles to you at your Q3 meeting, and I would anticipate that those drafts would reflect some of the conversation here today. And to your point about different content and different ways of presenting it or making it accessible does entirely depend on who the audience is. And so from sort of this initial blush, as we've talked about, thinking about meeting that legislative requirement around wage transparency for training participants, but certainly wanting to think beyond that in those next sets. I also just want to reinforce, while we are seeking to have a standard occupational profile format, there are nuances for healthcare that might warrant additional content or slightly different content. And so the feedback from you all has been incredibly helpful, and we can make those tweaks where it might be slightly different from your manufacturing or technology counterparts. And much of your feedback has been consistent with what we've been hearing across the other sectors as well. No, that's a great idea. I think we're at the heck. So Heather's question was, would it be too much to offer a glossary of terms? We do have a reference page. I think it's at the, no, is it at the back of the packet?
Rona was the reference page.
Yeah.
Yes, so there's a reference page. We can similarly include a glossary of terms, and that could be helpful across all three sectors. And I think we do want to make this as plain language and accessible as possible. So your feedback there is really helpful. I think the intent in the near term is to publish the packets by sector. So if you were looking for information about the healthcare occupation profiles, you would bring this up on the website. These would be live hyperlinks to each of the occupational profiles, and then you would have the reference materials, could have a glossary of terms as well. It's a great suggestion.
So with that in mind, could we just start with an initial poll here with the green, yellow, and red cards? Green being, I'm okay with you publishing this data set from the Healthcare Consortium on the HEC website as presented. Yellow, I think I'm okay, but I have some questions and we have time for discussing those questions. And red being no way. And also abstaining is an option here too. So you could just not hold up a card. So if I could get everyone to just hold up your card where you're at with this and let's just see. Call that a deliberative sunrise. Beautiful yellow. I think that's you all reached consensus about having consensus. So congratulations. Okay, I mean, so I think we have some time for discussion. How much time do we have, Jennifer? I'm sorry. Great. So let's talk about some of the yellows in the room. Anybody want to sort of like what that indicates to me is like I can be convinced, but yeah.
I do just want to note, Jason Payton's name keeps popping up on the screen. And Jason is with the employment department and did provide, worked really closely with Ronan on the data set and data development. So maybe if we could prioritize, if someone has questions about the data in particular, maybe we could start with those and you could even just stand your name card on end so that we can make sure and take advantage of Jason while he's with us and let him go if we don't have data related questions that Dan can.
Yeah, any data specific questions that we'd like to ask?
Okay.
Wait, we got one.
Let me take
have it.
So for the projected employment change by local workforce category, you said that there was 70% that responded, right?
That's overall, we hit 70%, sometimes upwards of response. That doesn't mean that like for every single one of these, that's the case. That means like when we're doing something overall.
Yeah, because I think that's the thing that if we are eventually wanting to target potential individuals changing their career, understanding that there probably is more jobs out there. And that this is not, and especially for something like nurse, you know, the nurse anesthetist, like that being so low, being able to call that out is like, there's opportunities out here, and this is a growing workforce that we're going to need more individuals in there. Because if we publish this right now, I'd be afraid that this would say, oh, I don't want to go into this career. And that's what kind of scares me the most.
I'm like Jason.
Yeah. Jason, did you hear that question?
Yeah, and that's a great point. You know, the survey is intended to be fairly robust across the state. But unfortunately, the way we sample these things, we're trying to get a comprehensive snapshot across all industries. And that's always a challenge when we're trying to get down to specific specialties, especially when we're talking about different healthcare specialties, different settings. We do have a fairly robust sample when it comes to differentiating things like those employed in hospitals versus clinics. But when we get into specific specialties where we can see a wide range of pay scales and specialization, that's the kind of granulation that large surveys like this have a real hard time getting into the minutia and the detail of. There are other sources that we can sometimes leverage. One of the great resources that we have here in Oregon is the job vacancy survey. We also have a wealth of information around job postings from around the state that might also help us inform about wages that we may not necessarily see within the survey. So there are some other sources that we can certainly help supplement and try to fill in some of those gaps that you guys are seeing.
Put a yellow card up because this is, I mean, I understand this could move forward as it is, but we're really close to making it much more usable. And I think beginning the conversation with who the audience was, I think many of us were really thinking about just how they were going to perceive the data, particularly looking at prospective students and their families. For me on the data, the one thing I think it would be really helpful having a statewide kind of summary of the data. And the projected growth, that, I mean, I see it here in this bar graph, but that takes a pretty high degree of quantitative literacy to try to suss out what the projected growth is. And so frankly, I think it might not even be very useful in higher ed, for example. You know, this isn't something that you can be able to put in a proposal to the provost council and heck, saying this is what the state said the projected growth there. So I hope we can see that in future iterations.
Just to add on to that, in terms of looking at where the growth is, looking at what openings are and things like that, these are to 2033. So it's 2033. And then the other thing is that for a lot of these, when I'm looking at it, I'm like, oh, that's actually a pretty high number. But contextualizing again, like I was like, okay, so if I've got, 2,900 job openings a year, is that a lot? How many people are actually, compared to, so yeah, just a relative, because that is relatively high, but I don't really have any context for that. So just adding a little more of like, to what endpoint am I talking about and how good of an opportunity is that?
It sounded a lot like the supply and demand conversation that we were having in our group too, as being important to them.
Yeah, our group talked a lot about who introduced this bill and why, and I just looked it up. It was the AFL-CIO. And it's all about workforce boards. I mean, the whole bill is about workforce boards and giving workforce boards information to do planning. So a lot of our conversation in our group was like, who is this? I mean, the whole bill is about workforce boards, and then this is a side note in the bill. So I guess I would just think that's probably what we should ground ourselves in this conversation, is that this seems to be about helping workforce boards do planning, to be able to think about apprenticeships and how apprenticeships can fit into wage standards hit by industries. And so I don't think this is meant for workers. I don't think it is really, I mean, from what I can tell, it's all about apprenticeships. It's all about workforce boards. And this is a side note in a very long bill. That does a bunch of other things around workforce boards. So I think as we think about this tool, or if it's going to be a tool, like that should be our, I guess I would say that should be our audience, because that's clearly what the bill was intended to do. And I do think this growth piece is a key part of how workforce boards can do any actually structural or helpful planning. And then it's clear that that's why the regional information is so important too, is because workforce boards are done regionally. And so I guess I would just think about I think this growth standards and what does this growth information look like? How much is this growing? And this idea of how many people are being trained to meet this demand, and is it enough? It seems to be the core element of this, and that does seem to be missing from these fact sheets. So that's what I can tell based off of the bill and the testimony that was submitted on the bill.
Oh, I just would say yes, and I think beyond just local workforce boards, it's also other workforce service providers or training participants in order to be able to share this information with training participants to understand sort of those key questions of what are the wages I would expect in this occupation, what is the amount of training that would be required, and to be able to sort of communicate that value proposition. So yes, and I think that's a really great point.
Thank you so much for that. That was really, really helpful context. I'm curious, so which occupations are included in the bill? Like, is it only apprenticeable occupations, right? Like, for example, I know you mentioned nurse practitioner, like nurse practitioner isn't currently apprenticeable, right? So, yeah.
It is specific to the industry consortia for healthcare manufacturing and technology and intended to inform work-based learning. So earn and learn opportunities that could be registered apprenticeship, capital R, capital A has its whole wage and occupation system. And I think the intention is for this to provide some of that same transparency to non-registered apprenticeship, so lowercase a apprenticeship, internships, and other work-based learning programs.
Yeah. It does seem like the wage data is a key element to like the bill, and like the kind of how do apprenticeship programs or how do training folks set up standards that then they're helping workers go into, and how do apprenticeships fit into the overall system. So that would be what I would say. And like from my sense, consortia were added in because that was a place to do the work. I mean, just like bluntly, like the place to do the work. But most likely, I think healthcare, it's clearly no one from technology testified on this bill, so I don't think it was about technology. I think healthcare was, there's, like our training partnership, RISE, testified in support of the bill. Who knew? They didn't write it, but I think they testified in support of it. And I think that comes from the fact that they're like, oh, this is helpful out there in the world as we're a training partnership trying to figure out how to recruit and retain workers, as we try to develop programs. This kind of information is helpful. So that's what I could imagine was their thought process. Which makes sense. And I think that it is kind of, so it just says to me, as we think about what is the purpose of this data, we should be thinking about it as, I think that Jennifer said this well, who are the people who are trying to develop programs to meet this demand? And then how do they figure out how to develop that program, and how do they prioritize amongst all of these different workforces? So that would be how I would think about it. And that could be workforce boards, that could be training partnerships, that could be community colleges. But I think that's the target, is the people who are trying to create the programs and think about both is this a wage that's competitive? Am I putting people into good jobs? Is this maybe a career ladder element? But it feels like those types of providers. And maybe it's to give workers information too, but I think that worker information be coming from providers is my sense. Is that it's not like a worker's gonna go search a database and choose a job. It's gonna come from a provider. And they're gonna be able to provide this information from that.
Yes, and so with the workforce boards then, because workforce boards, they don't really get to where they need to be without those community partnerships. And so would they then take this information and then distill it themselves down into the right parameters to explain it to their community partners and whoever else?
We have had some internal conversations about, once these are sort of in a settled non-draft form published, talking to the consortia about how we would do a roadshow or something like that with the target audience, how to use these, what these were designed to do, what they do well, what we recognize they have limitations on. So I think to that point, I think we are trying to think to that next step.
And would that get done differently regionally, depending on the workforce?
So it's a very, very good question. I'm curious, just getting the center of the conversation. Does anybody have any other questions? And we have time for more conversation, but I was thinking we could do another straw poll in a second.
The question that I have is if we see something in this that is incorrect, what is the process for getting that corrected?
I think you mean if it's a typo or something like that, then that's.
Well, for example, in the registered nurse.
The registered nurse profile right now says entry level is a bachelor's degree, and that's not correct. So when something like that comes up, what is the process for getting that corrected?
So that is actually something we took from the nursing demand planning work group as feedback, and instead of minimum,
instead of minimum requirement, we changed the language to typical entry level. So it's not communicating a requirement, a minimum requirement, but what is typically required and then comparatively to competitive. I think that language is from the employment department website. Do you have a definition?
It is.
Yeah.
And I'm.
Oh,
just because of the-
Jason's
yeah.
weighing in too.
There's a.
Go ahead, Gil.
Okay.
There's like a policy related thing that happens specific to registered nurses that affects the way that you would define typical definition versus like when Jason was mentioning our job vacancy survey versus like what employers say like, I would hire a registered nurse with right now. So go, Jason.
Yes, Jason, you are needed. Thank you.
Okay, so just to give a little bit of background on this, and registered nurse has been a very particular point of interest for us on this, and it's something that we have been challenged with. I'll say that straight out. The reality is that obviously from a licensing standpoint, associate's degree certainly can get you in the door. But if we look at the reality of the vast majority of registered nurses actually coming into the healthcare system, looking at what is being offered in terms of actual job postings, what we see typically is that the vast majority of those require some form of bachelor's degree in order to actually submit that application. We continue to see that to this day. And so that has been a challenge for us. But when it comes to working with high school students, kids just getting into post-secondary programs, we have to be honest with them that if they want to work in the hospital, if they want to specialize, that bachelor's degree probably is what they probably have to work towards eventually. And so that's where we had to sort of land on that. In most cases, we would just look at the requirements posted by job postings, but this one in particular, we've landed on the bachelor's because of a number of different factors.
So because these documents are really focused on regional differences, does the regional difference in what the typical requirement, is that reflected? So for example, if you looked in Southern Oregon, would that typical entry requirement from those job announcements say something different than you might see throughout the state?
Jason, do you have any insight on the regional differences in typical requirements?
Sure, I can't say that we have specific data speaking to that, but when we make these determinations, your question is exactly on point. It is a statewide analysis and determination. So it wouldn't be broken out down to the regional level.
I guess based off of what Melissa said, the intent of these sheets are for workforce boards. I think we really need to look at this through that lens, because when I hear that we're using this typical entry level and it's a bachelor's degree, I would assume that the workforce boards are going to want to know that there are 3 or 4 different ways. Like if this document is intended to be for workforce boards, I'm just gonna say, I feel like it needs a lot of work still. I feel like you would have to really lay out this occupation description a little bit more precisely. You would want to make sure that the education requirements are significantly more detailed as to what those pathways are, especially if they're looking at this for potential apprenticeship programs, potential growth opportunities, those types of things. I mean, obviously you need the wage stuff in there, and the industries of employment, I think, is beneficial. But I think as our group even talked about, a little bit more detail around supply and demand based off of the region and the wages based off of the region. And then this knowledge and skills boxes that are on these, one, I don't think they're very accurate. 2, I don't think they're useful at all. So, I mean, arguably utilizing the space to keep it to 2 pages, focusing on the training requirements or licensure detail, the salary, hourly and annual, the supply and demand, the occupational detail, both technical and soft skills, and then the industry of employment. I think those key bullets would be what a workforce board would want to see and make it significantly more user-friendly
that arguably you could give to somebody that is looking to apply for a grant, give to a legislator if they were looking to have a better understanding of these healthcare professions, not only overall general, but in their regional areas.
Yeah, almost the exact same comment. I guess my question is, the context is super important. So have the workforce boards or the maker of the bill been offered an opportunity to provide feedback on these profiles right now? That's where I think we should start.
I suspect this got put in a bill and probably no one's really paid attention to it since it was put in the bill. So I think we could so I think from my perspective, there's one section that people are saying is wrong and needs to get fixed or dramatically changed. That would be the knowledge, skills, and work activities. The other stuff is not generally, there may be one or two things that people could disagree on, but it's correct directionally. And my sense is that there's a desire to get something approved, to get it done, to at least publish something, and then further refine it and add all of the feedback in for the next iteration. So my suggestion would be that we approve these without the knowledge, skills, and whatever the third section is, subject to further refinement.
So can I get you all to use your cards to weigh in on Becky's? Well, let's just see where we get with this really quickly. So, yeah, can you use your cards to indicate your consent to what Becky just proposed?
So this is the knowledge, skills, examples.
Yes. Yes. So we would publish it with those removed. Seeing a lot more.
Publish it and then also refine,
And
further
refine
refine.
them.
That's gotta be part of it.
Yeah, your next set would come at the Q3 meeting.
Yes.
Yeah.
Okay, so I see some yellow, but not nearly as much as last time.
Yeah, maybe for those who are yellow, what would it take to get you to green? And if we could just go around the table, and then we want to make sure and break for lunch so that our panel has time to talk with us.
Yeah, I would just want to have a few representatives from workforce boards review what you put together.
Yeah, and I'll just comment to Brian's question. There are 2 local workforce board representatives on every consortium, so they are participating in the conversation. Yeah.
There you always the one.
I would suggest, I mean, to get me to green, it would have to be to change that typical. Because I think putting out information that is questionable in the minds of somebody who's reading this may cause them to make choices that maybe they would have otherwise done. I don't think that that's appropriate, especially if this is truly about regional differences, which is what it seems to be. It should be what the minimum, and it should. I also appreciate having the multiple different paths that somebody could with the minimum entry.
Can I ask clarifying question? So Dave, are you saying you would prefer to see minimum? And is minimum information available other than typical through employment department? I didn't think so. And would it, one more quick question. If we retained typical, because it again is repackaging information from qualityinfo.org, if we retained typical but included the definition, sort of the caveat for what typical means, would that help?
Okay. On one thing, and Jason's still here too to back me up if I get off track, but one of the things that Jason talked about that I want to reiterate is that in many cases, even if you can, and I think this is really mostly an RN thing. I don't think this is beyond the RN example. So maybe it's just about clarifying in this, or maybe I'm wrong. Maybe it's more pervasive across healthcare. But in the RN case, you can get the job with an associate's degree. My understanding is that in many cases, that is with the understanding that you are actively working towards a bachelor's degree when you start. So that's the part of the deal in a lot of the cases, right? So it's not like you can have this as an associate's degree, never take any other expectations and expect to keep that job long-term, right?
Correct.
So maybe it's worth the clarification in that occupation, if it's specific to that occupation versus tossing that out for everything. Because typically I think you are gonna be expected to attain that degree level in order to continue on in that job. If not, then.
Not every setting and not all.
Yeah, as from an employer
Yeah.
standpoint.
So I think, is this something that's isolated to this occupation, or is this something that's also happening with LPNs or, you know?
Well, if we're talking about the nursing
Yeah.
specifically, I think that this entry point into education, this is pretty specific to registered nursing.
That's what I thought as well, but I wasn't. Like
Yeah,
that.
it's pretty specific to registered nursing. Like,
I'm your
if you go
backup
and you
folks.
get an LPN, you're gonna work as an LPN until you do something else. If you go to be a CNA, you're gonna be a CNA, but that's just
Yeah.
for a little, not a huge amount of time.
Yeah.
It's really movement oriented kind of position. If you want to be a registered nurse, it's not a linear path all the time.
Yeah.
You can jump
Yeah.
in here, you can jump in here, jump in over here, work your way up.
So here's another suggestion. If the RN pathway is significantly different enough, we can pull that from this initial set and have more conversations about how best to address the educational pathways. Right now, we're approving initial set. We are planning to provide occupational profiles for the vast majority of the health occupations on that full data set. So if we can approve something today that gets healthcare in line with manufacturing and technology, so that we have an initial data set for each. And if RN is significantly different enough, we can pull that from this initial set and revisit it with the nursing demand planning work group and dive a little bit deeper into what that might look like if it needs to be different.
In the healthcare sector, that would be a little bit, I would be a little bit hesitant about, but I think that with some cooperative work, we can maybe get to a place where we that with the rest of them, it might be a little special treatment because it's a special case.
I'm just suggesting we would add it back in the set that you approve in Q3.
It seems pretty simple. I think we just need it to be associate degree. And as an employer, we would also support, like we take associate degree nurses all the time. So I think on that data, just be curious to see the percents.
I looked up from the job vacancy, well, on the side here. I looked up on the side, and again, we don't have a super large response to this, but looking at our own job vacancy survey from 2024, it looked like about 10% of the ones that were responding were saying something other than a bachelor's degree. So, but that's not, again, this is not a universe. This is, a survey that we do of employers that I think it's around 16,000 for the year, private only, so it's not government as well. So that's the only other data point that I have, and it still shows that that's the current what they're saying for those who answered us.
We're running out of time here, so.
Friendly.
Yes, please, thank you.
Remove RN from this set, approve the remainder of the set without the knowledge, skills, and the others. Yes.
Yeah, can we hold up our cards for Becky's friendly proposal?
I'm sorry.
So.
Yes.
All the qualifications we covered.
You guys should just proceed. I'm gonna vote yes.
Okay. Then that feels like consensus. We will pull RN. We will also pull knowledge, skills, and I think detailed work activities is the other category. You've got the mic, go ahead.
Yeah, I just want to say, I'm not gonna vote yes on this because this is just not, I just want to say this is not productive. So I don't know what the purpose of, I think there's lots of questions about the consortium. There's a bill that was passed that has lots of pieces in it about apprenticeships and training and development. And we're trying to produce fact sheets that I don't think anyone will use. So I guess I just want to say that I understand that we need to pass this. I feel like heck feels very a lot of pressure to meet a legislative deadline that I don't think anyone cares about. And I just want to say, like, I don't think the AFL-CIO, who clearly wrote this bill, or any of the sponsors have been consulted on this, and there's only one union representative on this entire council. So I'm very uncomfortable by the ask in this process, and I don't think there's any use to this data currently. So I think a lot of people put work together. I understand bills are written. I understand agencies have to follow them. I don't know how many unions are on the manufacturing one. I don't know how many unions are on the technology one, but I'm the only union in the room. And those are the only people who testified on this bill last time. And none of them have been consulted on how this data was meant to be used or how to be used. And we weren't even given that information when we entered today. So.
It's on the record. Thank you. So break for lunch?
Quick break. We'll get set up for the panel, and if you want to take a moment to grab a lunch. There's a number of lunch options in the back of the room, and we'll get started with our panel in about 7 minutes. Thank you.
Next session. So I have the privilege of just moderating the panel, which means I won't say very much, but hopefully get them all to say the things that you want to hear from them. So the way we're going to structure this is first we're going to go down and do introductions. So for the panelists, please share your name, title, and a bit about your organization and your role. Then Dr. Winningham is going to do a few slides kind of introducing this topic. And then after that, we'll have the panelists talk about their individual, expand more on the programs that they're involved in. And then if we have time, assuming we have time, we'll do a few discussion questions and some Q&A. So with that, first thing is name, title, a little bit about your organization and role.
I'm Rob Winningham. I'm a professor of psychology and gerontology at Western Oregon University. Also serves as our provost, vice president for academic affairs, college dean, but I'm happy to be back teaching now.
And I'm Sean Rausch, and I'm the occupational therapy program director at Western Oregon University.
Dr. Carlos Sexer Maldonado. I am the assistant professor. Do you want to switch mics? Okay. Assistant professor in the rehabilitation and mental health counseling program. I'm also the clinical coordinator and do many other services. But I'm also the CEO of Breakthrough Community Health.
Good afternoon. My name is Murray Ariola. In this role, I represent Interface Network. They're a community-based organization that works with marginalized communities throughout the Salem region area. And they focus a lot on health equity. And they work to support BIPOC communities in providing health navigation, OHP enrollment, training, and certain areas that sort of improve the healthcare within the region of the Willamette Valley. Thank you.
And I'm Phil Blay. I'm the division director for outpatient services for mental health at Marion County. And we serve 0 to 18 and then 18 to 95 is the oldest one that we have enrolled right now. And severe and persistently mentally ill on the adult side.
Okay, so if we can pass them right back this way, Rob, do you want to, I think you have a few slides that you said would provide some context for the conversation.
Yeah, so big picture, when we go to the next slide. This is a $2 million Future Ready Oregon grant to create more bilingual behavioral health professionals. And this is a slide from the behavioral health talent assessment. You can see that there is a huge need, particularly in our more rural areas. Most counties have less than one behavioral health professional per 1,000 employees according to the talent assessment. Next slide, please. And, you know, the talent assessment wasn't out when we started designing this program, but there was, in the executive summary, it was said that there's an understaffed workforce directly decreases the range and quality of care options. For example, shortages of bilingual providers and culturally responsive services exacerbate accessibility issues for diverse populations. This was one of the reasons that we did this grant. We saw this huge need, and largely in working with the counties such as Marion County, we saw that there was a need for more bilingual Spanish-speaking behavioral health professional, primarily licensed counselors. Next slide. So for this grant is really exciting. I think a lot about the pipeline in these meetings. We talk about the pipeline. And so we built the pipeline as much as we could into this grant. So Chemeketa Community College is a partner on this grant. They have a wonderful behavioral health program where now, this is kind of a pilot. Their graduates have a quality mental health associate credential in addition to a CADC1. Certified alcohol and drug counselor. So a great program. A lot of those students come to Western. The next spot along the pipeline would be the undergraduate programming. We're giving scholarships to bilingual undergraduates. But as we might hear more from Phil in Marion County, we have an Earn to Learn program where the undergraduates, if they're a senior, they're eligible for a QMHA, the 3 years of education. And they're working with Marion County under a licensed counselor. There's about a dozen students doing that. That's already underway. Then at the master's level, and that's something that Dr. Texador Maldonado could talk about, we have a LPC eligible program in our rehab and mental health counseling program. So we have the master's level. Dr. Rausch can talk about our occupational therapy doctorate. You might not think of occupational therapy as a mental health field, but it very much is. Most OTs kind of work in that, but some OTs are mental health specialists, and students that graduate from our program can become quality mental health professionals, even more in demand than QMHAs. But we also need to be mindful of clinical supervision. So OIN, which is the largest employers of Spanish-speaking therapists in Oregon, have part of this grant to do clinical supervision, not only in kind of a bilingual context, but also a multicultural context as well. You can't just take a student who happens to be bilingual, put them through a typical program, and have them prepare to serve the population. And then last but not least is interface. A community-based organization with wraparound services to support students. And that's where we are quite vulnerable and are just one car breakdown. And this happens a lot. One car breakdown can prevent the student from getting a bachelor's or master's degree. So if we can have some really quick funding in those situations, we can keep the students involved. And then that's the slide on for Marion County's program. So that was the introduction, where the rest of this I think will make a little more sense.
Great. Okay, with that, we are going to get into more of the specifics of these programs. And so for the panelists, tell us about your program, its track record of connecting underrepresented populations to these high demand occupations and careers, and then maybe some things that make you unique, successful. There are a lot of other questions here. You could talk about challenges, but what I really want you to do, I think, here is just to highlight for the group what your role in this initiative, in this effort is, and what you think that is so important for people to understand about the work you're doing and how it connects to the overall goal of expanding the training pipeline for this population.
Okay, so for the occupational therapy piece, as Rob mentioned, a lot of folks don't realize, just because it's changed in the US over the years, but occupational therapy actually started in mental health. My career as an occupational therapist, I worked for Yamhill County Mental Health for 4 years. I was the first occupational therapist on the early assessment and support alliance, their early psychosis program. So there are a lot of OTs who do work in mental health. And so our role is actually just trying to recruit more bilingual, multicultural OTs into the workforce. And so at this point, what we've chosen to do is actually take the pot of money that comes from this grant that goes to the occupational therapy program, and we're just dividing it across all of those students who enter our program this fall, who are bilingual and so qualified. And essentially, we're hoping to pay their first year's tuition in order to encourage them to go into a field that does provide behavioral services.
I'm truly honored to be here, first of all. And for me, one of the biggest pieces as
the clinical coordinator and an assistant professor at Western is that prior to even me stepping foot in the institution, Western has a reputation for really filling in the gaps. Historically, Western was one of the universities recognized for deaf or hard of hearing individuals that wanted to become counselors. So we had individuals from across the multiple states coming to Western because it accommodated the professors. The interpreting system was known for its quality care of students with disabilities. Now we're recognized as a Hispanic serving institution, and my role is welcoming and ushering in a culturally responsive way and mentoring individuals from our community that is their first time graduating, their first in their family graduating high school, the first individuals to graduate from an undergrad in psychology or other behavioral health. And now we're ushering them into Western to become clinical mental health counselors. So for me, it is an honor and a privilege. And really, I had the opportunity to have Phil be one of those in the field mentors that encouraged me and helped me find those pathways. So it's an honor to be here with him. And we need more representation. So for us, it's really recognizing the need to have other individuals that they could identify with that could help them navigate the academic world. We are also hiring a director that was graduated with their undergrad from Western and also their master's that worked in clinical agent, county clinical mental health agencies that has the knowledge of working in the communities. And that's what we need, the folks that know the landscape and the communities that we're serving and have the work experience and the academic knowledge. So it's just a wonderful time.
The purpose is so important because being part of Marion County, we definitely see the need. I mean, people are waiting 10 months to see a therapist speak Spanish. I mean, we cannot have that. That's insane. And so, Interfaith Network has been serving Salem and Lone Valley since 1986, and really focus on equity and the work that it does. And so part of the challenge is how do we serve these communities that really need Spanish-speaking therapists, but also, again, being advocate for Future Oregon, to know the model, having a great collaboration among our partners is just so wonderful. And I'm really honored, as Dr. Maldonado said, to be part of this program, because we believe we can uplift and gain new workers in mental health. So our role as Interfaith Network will be to support the students with the wraparound supports. For example, as Rob mentioned, if they need to repair the vehicle to go to class or to go to their internships, if they need a computer to help them study better with their courses, if they need gas money to reach their classes, if they need, hygiene bags, if they need, their internet paid, if they can't afford internet at their house or dorm, whatever that may be. But the goal is to make sure that they stay engaged with the program. And so part of our role is to be with the students on a regular basis to say how they're doing, how's life, what is their unique to have right now? Because that's really important. And part of the goal of Future Ready Oregon is that we need to support the most vulnerable people and give them a chance to be successful in these fields. And we believe through wraparound supports, the students that we're working with be more successful. And I think I'm grateful that we have this grant from Western University in the HEC, because we do believe that in 3 or 4 years, we're going to see more mental health therapists that speak Spanish within our region. And we need them badly right now. Middle school kids within our region have high depression rates, suffering a lot of mental health issues, especially that are Hispanic backgrounds. They don't have the access to mental health in a lot of ways that we need. So the support here is really tremendous. I'm grateful to be part of this team. Thank you.
So I'm gonna echo a lot of the things that these gentlemen have said as well. But I do think working for a county mental health organization, we do actually see the most vulnerable population because we don't refuse anyone services. So we don't get to pick and choose who comes in the door. Other than that they're working with them, but they have insurance. Not for the most part. But we have great partnerships with Oregon, but also all the other universities. So it's key to have relationships with major universities to continue to grow the field across the continuum. We've actually ventured into this year with Woo for I was venturing into undergraduates, and it's a long wait because you have to wait almost 4 years before they're actually eligible to do something on the mental health side of counseling. But it's a great investment. I think if you can get 30 people in, you get 15 therapists, you hope to keep at least 2 or 3 of them because there's lots of opportunity for bilingual therapy. The other big part that I think is key to this is thinking that we've got to build capacity. So when you have one bilingual therapist in an agency, they become totally they're the only person. When you have 2, you have sort of grouping. When you have 3 or 4, you actually now have culture. So it's part of the culture. So no one's sort of saying, oh, the Spanish speaker will go get that person. And it's a front desk reception job because they're the only Spanish speaker in the culture. So again, it's building that capacity, not only one professional at a time, but looking at how we're making the front door accessible to everybody as well. So not just on the back door. So how do we continue that way?
Okay, so let's move to talk about partnerships. It's great to have all of you here representing this project because clearly there are multiple partnerships involved in this project. So kind of 2 different elements to a question. One is like, what are the key strengths, assets, and capabilities that you're bringing to this work? And then also, what are the key components to a successful partnership that has made this effort successful that others could model?
Thank you. One of the things that Western is bringing kind of real generally, and I think we need to watch for this, particularly as the educational environment is rapidly changing. If you watch the news today, this week, this month, And one thing I would point out that Western, actually a story, you want to talk about the news, and today in OPB, how Western is the first Oregon Public University that is now officially a Hispanic serving institution. And in the disciplines where students are likely to go into behavioral health, and 25% is the cutoff for 2 years to become an HSI. But we're closer to 30% in the fields that would feed into this. And many of the students that would identify as Hispanic, they want to get back to their community. They want to go back oftentimes to the community they come from and get back. But Western has been very successful in helping these students graduate. At times over the past decade, we've actually had a reverse achievement gap, whereby our students that identify as Hispanic are more likely to graduate than our students that would identify as Caucasian or white. But that does not happen without intentional work. And one of the things that I think this group, we just need to be aware of if we're going to continue to try to serve underserved population is what happens to the federal funding for TRIO and the other federal programs that made that reverse achievement gap possible when we had the dedicated people working in that space. If that funding goes away, I don't know if that's a place where Oregon would come in and fill in, but we're going to go in the opposite direction if we lose that federal funding. So I think that's important. On the partnership piece, that has been huge. And actually, I think one of the reasons we might be up here, I mentioned to Jennifer in another meeting that actually, even if we hadn't got the funding, our conversations that we had in applying for the Future Ready Oregon funding were incredibly valuable. Even just working with Marion County and realizing the need they had for more bilingual counselors, that right there, and the ability to do earn to learn at the undergraduate level, in addition to a lot of their partnerships are at the graduate level, that was a huge discovery that we would not have had at the university, and we wouldn't have been able to kind of create this program, which I hope can be sustainable in the future. So the partnerships are key. It's about communication, and they really allow us to build and open some doors.
I think probably the most important piece of the partnership for me is the wraparound services and adding that element. Because it's typically, if we lose a student out of a program, it's not typically because of their academics, it's because there's something else going on in their life. They can't pay the rent that month. I've been in academia for about 15 years now, and I'm always shocked to find out that one of our students is sleeping in their car outside their internship site and trying to find places to shower before they go in. Those are the kinds of things that, especially with the vulnerable populations, those are the kinds of things that torpedo the careers and make it impossible then for that student to be successful. So for me, that's one of the most important pieces of this partnership, is having that wraparound support so that life doesn't end up torpedoing a great career and a great provider in the future.
For me, I would say visibility and exposure. We could easily stay siloed and to our duties and our everyday, but connecting and making sure we're out in the community and having community-based organizations come into the classroom and share what they do, provide examples, real-life experiences to the open the minds of the students of what it will look like once they hit the field. I think that's key. One of the other things that Western has been doing is really, instead of trying to play catch up, we're having connecting with our Salem Kaiser and the C-Tech program, and is looking at juniors in high schools that are graduating, and they have a training ground for the students. So when they graduate, they could potentially earn their hours to become qualified mental health associates, thus prompting them to continue their education. And then you're creating a fertile ground for new students to become interested in the field. Because again, I don't know, about y'all, but I know as a kid, I did not think counseling was going to be my profession as a sophomore, freshman in high school. So kudos to these kids that are already thinking that far ahead and wanting to help their peers and other community members. That's amazing. So we come and visit, we do presentations and partner up, and really similar, the same partners, because again, Dale comes and speaks to our students. We have other programs from the county agencies and other providers from the community share their experience. And I think that's fostering interest in the field, but we want to reach those that are not in our programs yet to, spark interest. So I think visibility and partnerships across the board.
I think one of the things that we're developing is a culture. We had a couple of meetings with students back in February and April, and students came with their families. And we all work together in these meetings. You can sense a sense of unity, but also commitment in the intentional work that we were all committed to the work and to the program, that the families felt it and the students felt it. And when they left and when we talked to them, you know what, I want to be a part of this. It's more than just academics, a sense of belonging, a sense of value and respect. And that adds value to any program, because programs exist everywhere. But when you really acknowledge an individual and they become visible and not invisible, they become more entrenched with the program. And I felt it. These meetings were very emotional, me with the students and the families, because for the first time they felt they belong somewhere and a sense of home for them. And so I think all of us as partners have that culture, a sense of respect and value of the students and the families that we're working with. And for me, that's so indicative of a partnership to be effective. Everything else we can work on, but having the sense of culture and commitment we all have as partners is tremendous. And I'm thankful that we have that as a partnership.
Thanks. I echo that as well. I think one of the biggest carryovers for the sense of community is that we actually support each other's programming. So if a client or an individual or a student comes to us and says they need something, we can actually connect them with someone at the table. Or one of our own connections. So I think that really helps sort of people feel comfortable, particularly in marginalized communities, because lots of things are done by, let's do the warm handoff. So it's about who you know and who you connect with. It's not like, here's a number of calls, this random person. It's like, I'm going to connect you with this other person. So sort of buying into some of those cultural values and beliefs and modeling those as community leaders as well. So I think, even though we don't have Shemeka here or OEN, I think we've supported each other's growth along this way. We also know each other's limitations. I think that's the other big part is I'm hoping that we all navigate each other's agencies well and support each other's growth, because there's no way that we can support everybody with the needs and shortages that we have currently. So
So last question from me, and then we have a few minutes for any questions from the group. You all have spoken quite eloquently about the population that you're serving and some of the challenges there and opportunities. And I think I'd like to ask as kind of the last question, what should this group be aware of that you've learned from this work in terms of the challenges and opportunities for connecting people with healthcare occupations and careers? So what coming out of this can you recommend to other people as they consider similar initiatives to help connect the populations that are historically marginalized or vulnerable with this kind of work?
For me, I'll keep it simple and short. We need the funding on the tuition side and or the earn to learn. I think that could allow students to kind of to get the funding. I was shocked. I did not think that we would be able to develop an entire cohort of bilingual Spanish-speaking students in the master's program, but they are out there. And with just a little bit of promotional activity, frankly, it was just doing $2,000 on Facebook. We ran some ads, and there were probably some other things. I think Marin sent out an email that actually did something, but with a very small effort, we had enough people for a cohort, but we have as many people waiting for if there's future funding again after this year. So if we want to do that, if we want to diversify this workforce, if we want to meet the demand for the bilingual counselors, we just need a little more money. Once again, we can keep this going.
Yeah, I don't know if I have anything different to add about it, because I would say the same thing. The money is the biggest challenge. You know, we hear it on the news all the time about tuition creeping up every year. And then that gap between the debt that somebody gets into to get into the healthcare professions versus what they're going to earn, how long it's going to take them to pay back, if they even can. So yeah, I would say the finance piece is the biggest piece. But I'm going to go back to that wraparound piece too, that also including that, because I've just seen so many people lose their way for things that were totally out of their control and things that weren't that complicated. So having that wraparound support, that connection to the different organizations, the good communication amongst the organizations, I think those are all key things.
I would add that definitely the tuition for further in their education, what I have noticed has helped is those that are already considered like paraprofessionals or QMHA, having agencies be flexible with their schedules as they pursue a master's degree, because that's where we have the biggest gaps right now, is in qualified mental health professionals, whether they be social work, LMFTs or LPCs. We need mental health professionals. So having those that are already in the behavioral health field and being flexible, accommodating, and some agencies are much better at doing that than others, encouraging the workforce to take that next step. And if we have funding, then that facilitates a whole lot of growth. And then we have created an amazing cohort this coming fall term. So this is incredible what we have accomplished so far.
Thank you. I think to create a systemic change or shift in how our industry works, it takes money. I mean, that's the bottom line. And I think Future Ready Oregon model is working effectively because does have dollars, support, as mentioned, wraparound supports. Without that, it would have been more difficult to support the students in all sectors. So I totally value and believe that wraparound supports for students that are getting trained in whatever they want to get trained in are so much needed, especially if you want to get new workers, people that are dealing with poverty, people that are dealing with vulnerable situations, and they can support their own educational pathway to whatever they want to do. This model works, and it will continue to work. And definitely, I think the partnership, the collaboration part of it is also a big piece. For us to collaborate together is very, very important. Sometimes we talk about collaboration, but it's not really real, intentional. This is real. We feel it in our hearts. We have the commitment and the passion for the work, and we know our community pretty well. So we believe that this partnership, I think even after this grant, to continue the work. This is so important. This is not going to get done in 3 or 4 years. It's going to take a lot of work to make change. Thank you.
I think marginalized communities think that money comes around a year or two, but it does take 3 to 5 years before it actually sort of a trust level comes into effect. So the other big caveat I would think is, everyone said money's always helpful. But the earn to learn opportunity, so people actually being able to get a hands-on reality of how am I really gonna apply this? Because I think when you go to school, it's still hard to realize how am I gonna actually apply this into a real production when I'm done. So I think earn to learn opportunities along with what utilities said as well.
So let's open it up for questions. I think one of the things that we've talked about in the context of Future Ready is just the ability to, and how important it is to identify, share, and then accelerate best practices. And that's one of the reasons that I know that this group is here today. So what can we learn from them today? What questions do you have for the panel?
So in the recent behavioral health talent assessment, one of the things that we talked about was the geographic distribution of the workforce in behavioral health. So not only diversifying, but the geographic distribution. I'm curious, do you know of your current cohort or even the applicants for the current cohort? Are they fairly Marion Polk centric, or do they come from other parts of the state? And then the second part of my question is, and Liz may know more about this, but I understand that a number of high schools across the state are standing up behavioral health pre-apprenticeship type programs similar to CTEC. And is there an opportunity to connect to those as a pathway?
I can get us started on the geographic question, see if others have more to contribute. We are, the students that we're serving largely are coming from our region for a couple of reasons. One, we looked at recruiting students that were already considering coming to Western. We also, the Facebook ads we bought, they were geofenced where people could come and live where they are and be able to commute to campus. So it was relatively limited that way. With that said, we do have students from all over the state. We usually have almost every county represented at Western Oregon University. And many of the students come from rural areas. So, and I think that's important given the behavioral health talent assessment. So I think we could do better. And I think that also we could actually promote programs like this further afield if we had, more time to do that. The CTE behavioral health is really exciting. So our department, we actually have a meeting with the Salem Kaiser CTE for behavioral health, which is one of the first. It's certainly the most robust. They have approximately 90 students who are juniors and seniors, and they're getting that QMHA. And I was surprised. We have 20-some faculty in psychology. 8 of them volunteered to come to that meeting and potentially work with that population. You don't get a third of your faculty to volunteer to do anything, if you pay them. And so I think that is something exciting. And when we think about future funding opportunities and building that pipeline out, I think that will have a huge return on investment. Any others want to contribute?
I can just outdo that number a little bit because 100% of the occupational therapy faculty have actually done presentations at CTEC already. And we're partnering particularly with their behavioral health program and really trying to get those kids interested in kind of that whole pathway. And we're working on developing those pathways from the high schools, particularly from those CTEC kinds of programs. But we're looking at how can we connect with all the kids. We even did presentations at a 4-H camp down at OSU last year. And it was a employment kind of career readiness kind of camp. And we went in and did, we did 5 sessions that day. We did multiple sessions with a lot of different students. So, we're going down to high school. We're looking even at middle school, even elementary school. We're looking at some possibilities of at least introducing them to these professions that do work in behavioral health.
Well, I was going to say that all the people that came to the meetings, pretty much people know each other. A lot of referrals, and that's really common by the way in the small community. People tend to tell other people that they know, friends or family, and that's very common. And I think through that network, we also build a good sense of communication with the community there in the Salem area and Marion County.
I do think with all the focus on mental health organizations getting more treatment, people are actually destigmatizing the outreach to treatment. And we're actually thinking more preventative. So I'm actually grateful that we're actually putting the efforts into thinking about getting more counselors, because not everybody wants to be a counselor, should be a counselor. There's a lot of people that are preventative work that needs to be done. The peer delivery service is great as well. So I think there's a lot of a continuum of care that could be developed. But the biggest outcome, I think, is the destigmatization of just having people talk about mental health. So I think that that's been a good outcome from those conversations as well.
Real quick, I want to give some more context. I'm Liz Reagan. I'm over at Oregon Department of Education. I primarily support the high schools that have career and technical education in the health sciences. And yes, CTEC is one of the first in the nation, to my knowledge. So Oregon is looking great. So CTEC is Career and Technical Education Center. It's over in Salem. They're a great school to go visit. I highly recommend it. But other high schools are catching on, right? So we have Sunset High School up in Beaverton. They are working with CTEC to kind of follow their model. So Beaverton, and now next school year, Lane County Schools. So Lane ESD is going to launch a district-wide program. They're going to start out with 2 high schools, but then hopefully add it to all their comprehensive high schools. And then also in Southern Oregon in the Rogue Valley, they're interested in doing this as well. So it's more information to come over time, but a lot of traction in behavioral health in the high schools.
Yeah, maybe one more question. I see 2 hands, so we can go really quick. If we don't get, we start, and then there's one behind you.
So first of all, thank you. This was fabulous and it's really exciting to hear. My question gets back to sustainability. I mean, we don't have any more future-ready grants that I'm aware of. There may be some behavioral health grants coming. But how do we figure out how to take this great work and shift funding streams, shift the way we do business to make it a permanent structure? I'm not saying, I don't know that you all have an answer, but I would say, Jennifer, that's our challenge, I think, as a consortium, to figure out how these grants are working and figuring out how we create wraparound services on a permanent basis. We don't have a structure item state to do that, and we can figure it out. I don't know if that's a question.
Anyone on the panel want to respond to that?
We will, Duncan.
The one part where it's kind of exciting, and I've heard you talk about this, Duncan, you were just looking at our existing funding sources and how can we solve some of these problems moving forward. One that is kind of exciting is on the CTE side. I mean, I think that is a potentially great collaboration between K-12 and higher ed. And I don't know where this is going to go, where like the meetings that we have coming up, but they want us to actually teach university classes at the high school. That is a proven method to increase college-going population, increase retention, shorten the time to degree and cost. So you can imagine some of the, the K-12 budget is 10 times larger than the Public University Support Fund. You could imagine some of that being used there for that transition. Beyond that, I think the tuition dollars are important, but I think the earn to learn part could be sustainable in the future, particularly if the credentialing goes well.
I might just add, we're hearing that broadly across the high scale occupations in healthcare, manufacturing, and technology, that coupling with work experience is almost essential at this point. I wanted to just follow up on Liz's comment. The Lane ESD program actually received a Workforce Ready grant in the most recent round. So that expansion program is funded in part, at least, through a Workforce Ready grant. And I understand as many as 13 high schools may have programs coming online this fall. So maybe we can connect to make sure that the numbers line up and that we are sharing with folks how those connections. Was there another question?
Yeah, we're like at the end of our time, but so let's do one last question, quick response, and then I'm sure these folks will, I mean, some of them may have to run in their cars, but maybe.
Okay, I'm totally fine with you emailing me the answer. I am in I'm trying to get youth into a cohort to get them into healthcare careers at a local community college. My issue is I am in a rural area and I have there's no public transport in the middle of town. But I got one kid that lives 20 miles up this rickety road with no, there's no way to ride a bike in town. So imagine I've got like 15 youth in that position, 18 plus, graduated or GED, ready to go. I've got the money to put them into classes. I can't get them there. Have you come up with a way to get these interspace out in the hinterland?
What is that question?
I'll give you my email.
It brings its own complication, but sometimes creating hybrid programs can facilitate that for access and transportation barriers. But again, you lose some of that connectivity in the classroom by having hybrid programs, meaning that some may be in person and some may be joining virtually. At least it'll solve one problem, but potentially create others because you have to train staff to maneuver and navigate and not forget about those that are joining virtually.
Yeah, I think, for example, if you're in Salem area, sometimes Interface Network works with a lot of youth and with other programs. What they do, they provide rides sometimes to the youth to go to their training to make their class what it may be. So I don't know if you work with CBOs in your local area, community-based organization that maybe have resources or whatever, but definitely partnerships with other partners would help a lot. Here locally, we also in Salem work with Chariots Transportation. They provide free bus passes, of course, but if you don't have that, then of course that's different. But definitely partnering with other providers or other partners within your area would help a lot. Maybe they have, maybe they don't, I don't know, but I think definitely having these partnerships really does help mitigate the problem sometimes. And so Interface, they provide rides. So if a youth can't make it to their training, or let's say they want to get there, whatever they may be, a staff person will out there, go get them from their house, take them to a training, and then take them back home. It's offered sometimes, because you're right, not all kids have, or students have access to transportation. And that's really, really, and they need that to make their training or to make their class.
All right, any final, if there are no final questions, I just want to thank the panel. This was amazing, super informative, also inspiring. And just thank you for the work that you've done on this program in the last couple of years, and obviously the outcomes that you're getting, which are really exciting to see. So Jennifer, I will get back to you.
Excellent, thank you. I just have a couple of closing remarks. Ronan, if you want to go to the next slide, just one more slide. And I think this echoes much of what you've heard from the panel, which it was so great to understand the breadth of the partnership and how you all are expanding both outreach and connections with students. It's unlikely that you will be able to read this slide, I'm now noticing, so I will make sure that we share this with you all in follow-up, but this is sort of the ongoing iteration of your priority work around nursing demand planning, behavioral health workforce, employer engagement and learning from Future Ready Oregon. And so appreciate the panel joining us today, again, to help us better understand what we're learning through the Future Ready Oregon investments, particularly around partnerships and the flexibility of funding to be able to respond to the unique needs of students and training participants. In the coming quarter, the nursing demand planning work group will continue to convene. Part of their work will be building on your recommendations here today around the occupation profiles. We do still intend to convene a behavioral health workforce work group to advance the recommendations from the talent assessment, and we're working closely with the governor's office. I know Sarah had to step out a little bit early today, but about next steps there and the investments proposed in the governor's recommended budget for behavioral health workforce. The industry consortia strategist, Nick and Shauna behind me for technology, we're also talking about how do we go back to the employer focus groups that we did across the state. Many of those employers indicated an interest in ongoing engagement with and opportunities to inform post-secondary education and training. And so looking for ways to develop a more formal mechanism for that in an ongoing way. And then at consortium meetings, do expect over the next year to continue to hear from Future Ready Oregon funded projects and partnerships across the state to inform our thinking about policies and program development and those pieces of the puzzle that are addressing barriers to equitable access to and success in post-secondary education and employment. And Ronan, I think if you push the next button, fancy animation will pop up on the screen. Our Q3 meeting, oh, too far.
There we go.
You took away the joy of the animation. So I'll just put a little plug in for our Q3 meeting. Those meetings are intended to be held outside of the Portland, Salem area. And so if you or your organization might be interested in hosting the Q3 consortium, it does provide us the opportunity, as many of you participated in the meeting down at Brogue Community College, where we got to tour that facility and learn more about the programs and partnerships there. We will be doing that in Q3. So more information to come. And now you can advance to the adjournment slide. Join me in thanking the partners from Western Oregon University. Thank you so much for sharing your insights with us. And thank you all for being here today. With that, you are adjourned 4 minutes early.